the hip bone. The hip bone, you guys can see these bumps. Remember what we call them? ASIS, AIIS, P, anterior, superior. Okay, try to read it. Iliac spine. Okay, ASIS, anterior, superior, iliac spine. Why? Because there are 4 here. Do you see these bumps? 1, 2, 3, 4. So 4 in the front, 4 in the back. You guys can see here? Are you guys with me? Do you see? 2 in the front, and there are 2 on the back. So the 1 are in the front, they start with anterior. So anterior, which one is higher? Superior means higher. Anterior, superior, iliac spine, and anterior, inferior, iliac spine. This side, the back side is called posterior. Posterior, superior, iliac spine, and posterior, inferior, iliac spine. Okay? So, between these 4, the most famous one that you can feel it on your hip if you touch it. Do you feel it? Which one is that one?
Anterior superior.
Anterior superior iliac spine. Or we call it ASIS. So if you see ASIS, it means anterior superior iliac spine. And if you guys are looking at the front part from the anterior side, do you guys see this is anterior? If you're looking at the front side, this is anterior superior iliac spine, or ASIS. And this one is the posterior one, inferior one. Anterior superior iliac spine, anterior inferior iliac spine. But the famous one is the ASIS. We usually you can also touch it. Okay, we talked about acetabulum. You guys also can see the one that I circled on the PowerPoint. Ischium, the sitting bone. Alright, muscles of the hip. The hip flexors, iliacus and psoas major. These 2 are also called together one more time, if you guys remember from the lecture or the lab, iliopsoas. These 2 muscles. This is psoas major and this is iliacus. These are called together iliopsoas. And psoas major is the bridge between the lumbar part of the spine and the hip joint. Yes, you guys should remember that this muscle is the bridge between the spine. We had a similar question on our lab too. The next one is rectus femoris. Rectus femoris is the only muscle of the quadriceps that is crossing the hip joint. So the only quadricep muscle that has effect on the hip joint is rectus femoris. Hip extensors, the famous one, gluteus maximus or gluteus major. Probably you guys know it. Gluteus max, yeah, or what? Yeah. Gluteus maximus or gluteus major. I remember one of the class I was thinking, there's a big butt, and everybody laughed. I was like, what? Oh, yeah, I remember now. I'm gonna say that too. All right. Gluteus maximus. What does it do? It's famous for hip extension. Okay. But there's a big but here, guys. Remember, for hip extension. Okay, and also it does hip abduction. Hip extension, and also it's involved in hip abduction. Adductors, what does mean adductors? They involve in adduction, okay, adding to the midline. This group, which means the muscles are in the medial side, okay, and gracilis, the most medial one that you guys can see on your slide also, is originated from the pubis. This is the only adductor that is coming down, and crossing the knee joint. So the only adductor that is crossing the knee joint is gracilis. And then we have adductor, magnus, longus, and brevis. All of them are originated from the pubis. But the difference for the insertion, the only one that is crossing the knee joint is gracilis. For abductors, gluteus medius and gluteus minimus, those are involved in hip abduction, and another muscle is tensor fasciae latae. We have also minimus. You guys can see here. I put all glutes together that you guys can see, gluteus minimus and medius. And this is another medius. And this is gluteus maximus, or also it's called glute major. So glute major, here's my question. We had it in the lab, you guys should know that. Because only gluteus medius and minimus, they are involved in hip abduction, what is the common movement between gluteal muscles? We said gluteus major or gluteus maximus, it does extension and abduction, but gluteus medius and minimus, they do only abduction. Which means the only movement that gluteal muscles do, that they have in common, is abduction. Because we cannot say extension, because for extension, glute major does extension, but glute medius and minimus, they don't do. So abduction is the one. Alright, starting with the knee extensor. The quadricep muscle, it has 4 sets. Quad means 4. So quadriceps, which means 4 heads. There are 4 muscles. Vastus lateralis. This one, that is in the lateral side. Okay. Vastus medialis, the one that is like a teardrop in the medial side. And then vastus intermedius, we cannot see that one because that is the one under rectus femoris. And rectus femoris is the one that I said is crossing the hip joint and also So it has effect on the hip joint and the knee joint. Which means vastus intermedius is the one under rectus femoris. Vastus lateralis, you guys can see on the lateral side, and the teardrop medialis because it's in the medial side. So it's easy to remember vastus lateralis, the one in the lateral side, vastus medialis, the one in the medial side, or the teardrop. But the only vastus that left, so the one that is in the middle, intermedius, that is the one under rectus femoris. And knee flexors, biceps femoris in the lateral side, and semitendinosus and semimembranosus, they are in the medial side. You guys can see. Do you guys remember when I said how you remember the difference between these two, semitendinosus and semimembranosus? Which one is on top of the other one? Do you guys remember? Semitendinosus, just remember, because it has tendon in it, and you can feel the tendon here, so that is the one in the top, on the surface. That's why you can feel the tendon. We're assuming that. You can feel both tendons, but just to remember which one is deep and which one is superficial. Semitendinosus is in top of the semimembranosus. What is the heel pain? Okay, plantar fasciitis is the heel pain that is a result of inflammation because of the overuse. Say it, you said yesterday. Overuse.
It says overuse,
bad shoes,
heels,
running too much on the hard
being on your feet
surface.
too much.
Yeah. So heel pain, plantar fasciitis. This is the plantar fascia, you guys can see, and the inflammation of the plantar fascia, the heel, is the heel pain or plantar fasciitis. Just remember plantar, like plantar flexion, is in the sole of your foot, so plantar fasciitis. And this is a fascia, the inflammation of the fascia. Alright, abdominal muscles. We're not going to talk about the direction of the fibers, but you can say, based on the name of them even, rectus abdominis, this is vertically, it goes this way for the six-pack. Transverse abdominis, the fibers are going transversely. And then internal and external obliques. Between these two four muscles, which one is the deepest one? The deepest one, deep.
Transverse?
The transverse. So the transverse between these four muscles, the transverse abdominis is the deepest one. The direction of the fibers for the internal oblique, it runs upward towards the medial side, and external, I mentioned also in my lab, it's like you guys are putting your hands in your pocket. If you want to remember the direction of the external obliques, then you put your hands in your pocket, that is the direction of the fibers for external obliques. And the name is obvious, external obliques. This is more external on top of the internal oblique.
So external is putting your hands in your pocket.
Yeah, external, it's like you're putting your hands in your pocket.
And internal.
It's going upward, it's in, like, it looks like a cross. The external is going this way, like you're putting your hand in your pocket. The internal is, like the external is like you're putting your hand in your pocket, like this direction. True? Internal is going in this direction.
Okay.
But which one was the deepest one? Transverse abdomen. Okay, probably you guys need to know how to spell these 5 parts of the spine. Alright, the part for the neck is called cervical. It's formed by 7 vertebrae, and then thoracic, lumbar 5, thoracic 12, and then lumbar 5, and then the sacral part is formed by 5 fused vertebrae. We call it just one, sacrum, and then the coccyx. Don't forget coccyx or the tailbone.
Just curiosity, if you damage or injure the tailbone, is there any way to fix it?
Just you have to rest for a while. Yeah.
I mean, you sit on a donut, like a swimming kind of donut.
Oh, really?
Like the
Yeah.
kids like go in this. My aunt was pregnant and she like was going down the stairs and she like stepped wrong and hit her like butt and it just went down the stairs.
Oh,
and
yeah.
broke her tailbone and they just made her sit on like she went to Walgreens and bought like a little inflatable. And I fell off the stomach part.
Yeah, you have to sit on the donut because when you're sitting, your ischial tuberosity,
It hurts.
your ischium is going to be on the donut, and the middle part, the tailbone, is going to be like empty space, or not irritating more the tailbone. So starting from the top, you guys say it one more time, then we go to the next slide.
Cervical, thoracic, lumbar, sacrum, coccyx.
Ooh, this is the fun part. Okay, when you're looking at the muscles, they're super obvious. They're not very complicated muscles that you don't know them. But you don't need to label all of them for the exam. But you need to know them. Which one is which and
And you said there's gonna be a word bank, right? Like there's gonna be like a little word bank or?
yeah, you guys have a word bank for them. You don't need to remember for those. There's a word bank, but you need to be able to identify them. So we're gonna start with A, sternocleidomastoid. That is this muscle on the neck. You guys can feel it here.
Wait, Taeyeon. Oh, I thought you meant Taeyeon.
Where is B? Alright. Okay, A, I'm gonna start from just one side going down, and then you guys can even type it. Do you want me to go to give me a hard part.
Just say it
Wait,
really
are you ready? S-T-E-R-N-O
Like sternum, because it's sternum.
Right.
C-L-E-I-D-O-M-A-S-T-O-I-D.
Perfect, thank you.
Yeah.
You don't need to spell it for the exam, but I mean,
I'm making.
So there'll be no pressure like a word bank.
yeah, there will be a
Okay.
word bank, but
I was like,
you need to know when you see, yeah, it's hard to remember those words. Even I have a hard time to spell them. So, do you want me to go A, B, C like that, or you want me to start from one side? and-
ABC.
A, B, C. All right, A is here.
B's on the lip.
B. Oh, why is
On the
blue?
lip.
Yeah.
B is right here.
Is that
Remember which one was the
sartorius?
sartorius? Good job. The longest muscle in human body. You guys say it. C. You guys know what is C?
Deltoid.
Deltoid. Good job. C is deltoid. What is D?
Pectoralis major.
Major, good job. Pectoralis major.
E is.
Where's E?
Where is E? What?
There should be an E.
You forgot E.
A, B, C, D,
Is no, it's not.
E.
No, you forgot E.
Where is F?
You forgot.
A, B, C,
There's
D,
a double
E,
F.
F, G. Where is G?
He's like. right
Okay, let's go with these two.
That's FF.
Alright, let's go with FF.
Maybe that.
So that's G. I see G.
That is the.
Alright, that's the fascia.
Fascia.
Yeah, that's the fascia under G is right here. What muscle was the one that I said in hammer curl? It's involved. Brachioradialis.
Brachioradialis.
Brachioradialis. G and GG. What is the muscle in the anterior part of the tibia? Anterior, yeah. Anterior tibialis. Good job, Mackenzie. Anterior tibialis. H. External obliques. We just talked about that. You're putting your hands in your pocket.
Hands in your pocket.
Hands in your pocket. A, B, C, D, F, G, H, I. I. The muscle of
forgot to put I on there. Oh wait, no, it's
I is right here.
Yes.
The muscle that is crossing the hip joint and the knee joint, part of the. Say it again. Rectus femoris. That is the muscle that is crossing the hip joint, one of the quadriceps that's crossing the hip joint and the knee joint. And which one was like a teardrop?
Vastus medialis.
Vastus medialis. J. You guys see it looks like a teardrop here?
What was J again?
J.
Yeah, vastus medial. Okay, vastus.
And the
Vastus
one
medial.
that's across the hip and the knee joint, that's the rectus.
Femoris. Rectus femoris. Yeah, rectus femoris is the one is in the middle. When you're flexing your quad, you can even see the one in the middle, right here. Yeah, that's the only one crossing the hip joint. What was GG?
Anterior tibialis.
K is the tendon of the anterior tibialis. Here is L. Do you guys
Serratus
remember?
anterior.
Good job. Say it again.
Serratus anterior.
Louder. They want to type.
Serratus anterior.
Good
And
job.
also here.
Serratus anterior. Good job. Okay, what is M?
Where is it?
Say it louder. They want to
Biceps?
type. Biceps brachii. Again, you guys have a word bank, but it's good. Just I want you to know that you know. Okay? Don't underestimate yourself. So M, biceps brachii. What is N?
Rectus femoris.
No.
Transverse? Oh,
No, yeah, rectus abdominis.
Rectus abdominis. What is O? Okay, when the person's hand is like this and is pointing here, which means what muscle is this? Flexor, digitorum, flexor, digitorum, longus. Flexor, digitorum. Alright, I mean O, P. Okay, we don't have P. We don't have, we're going.
Maybe put P on the one at the top
There's
left.
probably 3 pictures, and.
Oh yeah, we have mix of the no.
Because it goes A, B, C, T, S, R.
Okay, yeah, let's go with S. What is S?
T1, T2, T2.
T2, but the whole muscle.
It's like 3 words.
Trapezius, yeah.
Trapezius.
Why is trapezius? Because of the shape of the muscle, just remember that. You see? It's like the shape of the muscle. That's why they named it based on the shape of the muscle. Trapezius. And T.
Teres minor.
Then you have, yeah, say it again. Yeah, because teres major is here. That is the lat helper. But the one that is pointing, I don't have the right scapula. So it's pointing at this point. The muscle is under the spine. Is infraspinalis. What is U?
Triceps.
Triceps. What is CC?
Latissimus dorsi.
Latissimus dorsi. Good job. The big white muscle on the back. What is BB?
Gluteus maximus. Medius.
No.
Maximus.
Maximus or major. Glute major or gluteus maximus. What is Y? Which one was of the hamstring group was more superficial?
Tendinosus.
Tendinosus. Yeah, you could feel the tendon because that one is more. So Y sequestration. Semitendinosus. What is Z? Gastrocnemius. Gastrocnemius. And what is AA?
Achilles tendon.
Achilles tendon. Good job. He talked about that today. Alright, you guys had a long day, I know. You can just cover that part of your done. Alright, on the left side, what is A?
Glenoid or head of the humerus. Is it pointing to just the humerus or like?
You guys have a word bank, so you guys know which part it's talking about. I know that you can point at head of the humerus, you can point at like glenoid cavity or glenohumeral joint, okay? Or the shoulder joint. Look at the word bank that you have. That's why I said just read everything, don't rush, take your time. So head of the humerus, A. What is B?
Radius.
Radius. Good job. Radius. What is C?
Medial epicondyle.
Medial epicondyle. Good job. And you had a question in the exam. The only part that you can feel is your hand. Medial epicondyle, right? You don't need to know that, but I mean, like you can feel it. And A, B, C, D. What is D?
Anterior,
ASIS, anterior
superior, iliac,
spine, or
ASIS,
ASIS. So we covered also D. What is E?
neck of femur.
Greater trochanter. Good job.
Greater what?
Greater trochanter. Remember greater trochanter and lesser trochanter and proximal part of the femur. So greater trochanter. What is F? Patella. What is G?
Tibula. Tuberosity.
Yeah, you guys. That's correct. Say it. Anterior. No, not say it. Tibial
Tuberosity.
tuberosity. That is the part that the quadriceps is inserted. Tibial tuberosity. Which bone is H?
Tibia.
Fibula. Good job. Alright. We have tarsal bones, metatarsal, and phalanges. What is I and what is J?
Metatarsals.
Metatarsal and J,
Phalanges.
phalanges. Or when it's the joint, what joint is that one? No, this joint. The one that is between metatarsal and phalanges is metatarsophalangeal joint. PIP and DIP, those are between the phalanges. Okay. I rather if you have something in your mind, that's why I'm asking you. If you say something wrong, it's okay. Okay? If you say it wrong, it's gonna stick to your mind when you correct it. It's better to. That's why if you say it, you would correct yourself, so you would remember. You would never forget it. All right. So I, J, and do you guys remember the bumpy bones on the wrist? Styloid process. We don't have it here, I just asked.
Oh.
But you need to know that. Styloid process. Do you see it? The spikes. So styloid process, and we have a similar one. What is K? Medial malleolus. Good job. Medial malleolus.
We both got it right at the same time.
M-A-L-L-E-L-O-U-S. Is it double L or one
Double
L?
L.
It's double L and then single L.
Okay. Malleolus.
M-A-L-L-E-O-L-U-S.
Sorry, I was slow.
So we covered I, J, K. Which bone is L?
Tibia.
Tibia. Good job. What is M? Okay. There's here we have epicondyle and we have condyle. Condyle is the one that's forming the joint, like the rounded part. Is it condyle or epicondyle? It depends on your word bank. Okay? Which part is medial side or which one is lateral side? You guys say what is M?
Medial.
Medial,
Epicondyle.
epicondyle, or condyle. It depends on your word bank. And what bone is N?
Femur.
Femur. Do we have both?
No.
Okay, we have P.
Carpals.
Carpals, good job. Carpal bones. And what are this one? We said carpal and then
Metacarpals.
metacarpal and
Phalanges.
phalanges. What is Q?
Ulna.
Ulna. R?
Humor.
Humerus. What is S?
Scapula.
Scapula. What is T?
Corner process.
Yeah. Carpoid process. This part. This is the carpoid process. This is acromion process. So acromion process is the one at the top that is forming a joint, the AC joint. This part, but we're talking about this process. That one is carpoid process. All right. If you guys have any questions, feel free to email me. You guys got the idea what to study and what you need to know.